You gonna come say hi? Hmm. Come say hi quick, and then I'll get started. Yeah? Okay. You silly bunny. Good morning, everyone. Fern is here to act grumpy like she didn't act like she wanted to say hi, and then she'll run away. She's very old, so she kind of gets to do whatever she wants. Happy New Year. It is crazy that we're already this far into the new year. Um, and it has been a little stressful, probably for most people. So hopefully everyone is doing okay. Um, I have some questions here that I'll just like get right into. And if anyone logs in, I will let you in. And if you have questions live, of course, you can ask your questions live. Um, so the first question is from Sessa. Hi, Sessa. It is going to be nice to see you again. She has a question about taking magnesium. Any suggestions for someone who has a very hard time with magnesium? I can't seem to take electrolytes in my water. And magnesium of all variations. So she says citrate, glycinate, etc., seems to cause her to have very loose stools or diarrhea. And she wants to make sure that she's getting enough. So she's trying to figure out how to take it. So I have been in the same position, so I definitely know that this is real and also that it can change. So hopefully that's hopeful. If you can't tolerate magnesium orally because it gives you loose stools, it is not uncommon. You know, magnesium citrate as the primary type of magnesium that can help to loosen the stools when people need that effect, is pretty effective and pretty powerful. So, of course, if you don't need that effect, it could make your naturally kind of like faster, looser digestion worse. Magnesium citrate is the most likely form to do that. Magnesium glycinate is probably the second most likely type. And then there will be other types of magnesium that will be like a lot less likely, but they are all still magnesium. The thing that makes them different, the reason they have these different names, is about what the magnesium is bonded to. So you will notice that not only do they have different names, but they will have different recommended doses. Like the dosing of magnesium oxide is pretty small compared to the dosing of magnesium citrate or glycinate. You know, I think it can be like 15 or 30 milligrams for the oxide versus like 150 or 250 milligrams for the citrate or glycinate in like a standard capsule, for instance. So you could try one of the less common variations, someone other than Sessa. It's clear that Sessa has tried all of them. Um, so the first thing I would say is that if you can't take it orally, don't take it orally. There may be some of it in a prenatal multi or some other combination supplement that you're taking, and it's possible that you tolerate that better. And that could possibly be sufficient additional supplementation to make it so that you don't have to be super concerned about having enough of it from a single supplement. But some people won't be able to tolerate it well in a multi, like in a prenatal multi or another multi-nutrient multi either. So the best way to take it not orally is to take it through your skin. So you can do Epsom salt baths. Epsom salts have a lot of magnesium in them, and your body will absorb it through your skin. Or you can do a topical magnesium oil or cream preparation. I had no problem at all with loose stools with topical magnesium. I do better with an Epsom salt bath because I also have kind of sensitive skin that leans towards being itchy. Even if I don't end up with any kind of rash or hives or anything, my just experience of having things on my skin can make them feel itchy to me. Um, and so I liked getting it through a an Epsom salt bath better because you're in the bath and then you're out of the bath and you can rinse off and then it's not, there isn't anything on your skin. But I have also successfully used AIMEE'S magnesium oil and like I think it's called Ancient Minerals has a magnesium oil. Now has a magnesium oil. There are lots of topical magnesium oils out there, and I have successfully used AIMEE'S without feeling itchy. But I put it on slightly different parts of my body than the like typical classic kind of like default recommendation when you use a magnesium oil is to use it at night and to spray it maybe on like the bottoms of your feet. Um, you're looking to spray it onto surfaces of your body that will be like will be able to absorb it well. So putting it on the bottom of my feet, I felt itchy. Um, and I didn't like that sensation. And once I rinsed it off, I didn't feel itchy at all. So I wasn't having a reaction to the oil. I was just having a sensory dislike for having the oil on my skin. And so then I tried it on like the inner part of my arms and the inner part of my legs, and that was better than my feet, but it's still, I maybe I was being hypersensitive, but I still noticed it. And where I found that I could do it just fine was spraying it on the outer parts of my arms, where there's just fewer nerves to sense things. And so spraying it on my outer arms, no problem at all. Now, the second thing about this, where I said that it can change, is that I no longer have a problem tolerating oral magnesium. And as part of this program, you are going to do a GI map and you're going to do some work specifically to address the results of that test on your gut. And that is going to improve and change your gut function in a way that will change the way that you absorb nutrients. And so it is possible, can't promise it, but it is possible that as we address your gut function, this will become easier for you. And where you might not have tolerated oral magnesium in a prenatal multi or some other combined supplement, that may become much easier for you. Or you may even be able to take a magnesium supplement, probably not a magnesium citrate, but something else like a magnesium L-threonate or glycinate or malate or oxide or something. So the top thing to do with magnesium specifically is to do it topically. Lots and lots of people do it that way. If they don't like to swallow pills or they struggle with swallowing pills or they have difficulty tolerating magnesium or they just prefer doing it topically, it's totally great. And you can do that two ways. You can do Epsom salt baths and you can use an oil. And I can give you recommendations for an oil, but AIMEE has one. It's called Maggie's oil, so you can look that up on the website too. Yeah. So the next couple of questions are from Lena. And I think we had a group call on Thursday with Lena's cohort, and she was there. So I actually think that this first question we have already addressed in that setting um, because this was posted late for the last Q&A session and wasn't answered then, so it was reposted here. But she is asking about staying optimistic when she feels like everything is failing and she's feeling very, very anxious. And then she mentions that her HSG after her hysteroscopy failed. And she was wondering if doing it 3 weeks post-surgery was too early. So there's a lot of context here that I know. And I think we addressed it already, but I'll just like make it a little more general for the rest of you and then move into talking about staying optimistic. Lena um, had a hysteroscopy and had some scar tissue removed that is believed to have been blocking her tubes. Um, and this was discovered after she had an HSG, a hysterosalpingogram, when which failed, which did not show that her tubes were open. And she has a history of having um, conceived naturally, and she has a child, but she also has a history of having failed HSGs or having an HSG kind of like clear a little bit of fluid or something else that was blocking the tubes a little bit, and then being able to conceive after that. But the hysteroscopy removed enough tissue, enough scar tissue, that she was diagnosed with something called Asherman's syndrome. So, Asherman's, I'll just pull up like someone smarter than me's definition of it to read it to you, but it's really about making scar tissue inside the cervix and the uterus. So, this is what Google says. It's a condition where scar tissue, which are also called adhesions, forms inside the uterus or cervix, often after a surgery or a D&C or an infection. But sometimes it happens when we don't have a specific cause that we know of. Um, it can reduce the uterine cavity size. It can distort the lining, as we just talked about. It can, if it's in the right place, block the opening to the tubes, etc. Sometimes people find out about it because they have changes to their menstrual periods. Sometimes they find out about it because they have pain. Sometimes they find out because they have um, recurrent miscarriages. Sometimes because they're not getting pregnant, which is Lena's case. Sometimes they just find out because they have a hysteroscopy. And so with anybody, people, not everybody who has some scar tissue form in their uterus has Asherman's. Um, but anybody, whether they have any scar tissue, any history of any scar tissue in their uterus or not, it is a little bit of a circular thing where if there is any scar tissue that has formed, then though most of the time the appropriate thing to do is to remove it surgically, and removing it surgically is one of the things that can cause scar tissue. So for most women who are at this end of the spectrum where they've never had any scar tissue, this doesn't become a factor. Or if they have a little bit of scar tissue that needs to be removed and it is removed, it doesn't return and it is not a factor beyond that particular event. A few people have scar tissue that needs to be managed. An example of this might be a girl who has a C-section scar before she um, tries to conceive again with a second baby. We often like to take a look at the C-section scar just to make sure that it is well healed on the inside of the uterus, which obviously you can only see if you do like a hysteroscopy. And that's partly because we want to make sure that it's not going to interfere with implantation or anything like that. And partly because you you could have an ectopic pregnancy where instead of the embryo implanting someplace outside of the uterus, it implants into the scar tissue in the uterus, which results in the same type of risk in an ectopic pregnancy that it would if the embryo was implanting outside of the uterus. The scar tissue itself is an inappropriate site for implantation because it cannot allow all of the structures and things to grow that are needed to support a healthy pregnancy in the way that healthy lining tissue can. So there are reasons without Asherman's to, be aware of scar tissue, and then you do have to recognize that there isn't an easy way to be 100% certain that you will both remove it and not cause any more of it. Now, there are some things, and we've talked about this stuff with Lena, there are some things that are some of them are relatively new that doctors are doing that can help with healing, that can help reduce scar tissue. The oldest thing that's the most common is putting a balloon into the uterus right during the procedure so that any healing that happens when the scar tissue has been removed happens with the uterus kind of like open and held open by the balloon instead of being kind of like folded in on itself, because what the balloon is keeping from happening is two parts of the uterus kind of like healing stuck together, because that would be bad. So she had a balloon. But you can do a wash of PRP in your uterus. And they are also now doing a few people are doing some injections into the lining of PRP, which is platelet-rich plasma, which delivers growth factors in order to help the lining to heal and replenish itself in a very healthy way so that it doesn't form more scar tissue. So it is possible that this HSG that Lena had to confirm that her tubes had opened after having the scar tissue removed was too early at only 3 weeks, and that her uterus was still healing. We don't know entirely. We already talked through kind of like a plan for what she's going to be doing next, but she's having a she's having a particularly difficult time with these procedures and with this scar tissue. There's a lot of hope, and there are many, many, many women who have Asherman's and who go on to have healthy pregnancies. So it's not a deal breaker, but she is struggling, and that's why she's saying she's having a hard time staying optimistic. There's a late question that came in um, that's kind of like linked to this from Doreen. I don't know you yet, Doreen, but it's nice to meet you. Um, and she says she's under extreme stress due to a family situation. Um, and she says besides deep breathing, yoga, etc., are there things she can do? She specifically asks about supplements she can take to ease the stress. And then she talks about being on LDN and asking about whether she should increase the dose. And there's actually a second question from Lena about LDN. So you're like totally in sync, the two of you. Um, yes, when something big comes up, whether it's specifically about your fertility journey or whether it's something unrelated that's still a big part of your life, like what Doreen is seeming to um, indicate is going on for her, we do have to do as many things as we can to care for ourselves. So sometimes you just have to get through a certain portion of what's going on. You have to kind of like use your limited valuable time um, kind of as wisely as possible, just like to get as many things done as you need to get done in order to deal with whatever crisis you're dealing with. So that could be scheduling appointments with doctors and like going in and having surgery, but also managing the other children, family members, pets and things in your life, your job. Or it could be like putting another person's needs first, whether it's a child or a partner or a parent or someone else, so that you can kind of bring the crisis level down. And sometimes you need to just sort of like deal with enough details that you get a little breathing room. Once you have a little bit of breathing room, and if that period of time where it feels like you have none lasts for a long time, if it's not like a very distinct, focused, short period of time that you already can see will pass, then we have to talk about it differently, because that's being almost like trapped in this loop of anxiety and feeling overwhelmed. And we need to force a way out of it. But in these cases, like you get this bad news or you have this family event that comes up, you may need to allow yourself to focus on kind of getting a little bit of space for yourself, a little bit of time. Um, and so if you are unable to focus on yourself during those first few days, maybe week or so, 2 weeks, that's okay. But pretty quickly, we do need to make some space for ourselves. And then different people are going to benefit from different ways of using that space. And so part of what we hope that you already have started to do and that you are always like continuing to do is listen to your body and your heart and mind and know or learn what helps you the most. So I was talking yesterday or no, Thursday with a woman who has a lot of time. So time is not her issue. But she doesn't like meditating. She finds that it feels inauthentic to her. She feels like she's very bad at it. She doesn't feel like she gets anything out of it. And so we were talking about how she could, instead of meditating, just do breathing. And it doesn't even have to be deep breathing. She's going to lie down on her bed for 10 minutes at a time, twice a day. And she's just going to focus on taking complete breaths, like feeling that your lungs fill and then slowly exhaling the air out until you feel that they have emptied and then filling them again and then exhaling again in a very intentional way. And she's not going to focus on trying to empty her thoughts or empty her brain while she's doing it. Just the act of doing the breathing is going to help to empty her brain and slow down her thoughts. And it's also going to change the way that her body is expressing a stress response. Like your fight or flight hormones are going to respond differently to that. So maybe if you've been trying a specific type of deep breathing, Doreen, maybe instead of that, you should try just taking full breaths. If you like meditation or you have had success with it before, you've always wanted to try it, start with guided meditations. That way you don't have to come up with a way of kind of clearing your mind on your own during the time. And AIMEE has a bunch of guided meditations. There are all kinds of guided meditations out there available that are fertility focused, but you don't have to use one that is specifically fertility focused. You can use them, you can listen to them that are on a variety of topics, things that would be, helpful to you. Um, because you're in this program, I would really encourage you to like reach out to us, reach out to your coach and talk about what's making you anxious or what you're experiencing. So if Doreen is having a family problem, so it's not fertility related, but is she now up at night, like having insomnia, having difficulty sleeping, either difficulty falling asleep or waking up in the middle of the night or waking up really early in the morning before she needs to, then we might be able to help you address your sleep in a different way. If you're having physical reactions like I tend to get nauseous in response to all kinds of things. And when I get hyperadrenalized, I either like lose my appetite or I get nauseous. So if you are struggling to eat well, to eat good foods because you're feeling a little bit sick all the time and kind of responding to that in terms of the food choices that you make. If you are avoiding eating because you don't have enough time or enough bandwidth to like plan food, especially if you're trying to follow something like the egg quality diet and you're feeling like it's too much, you should also contact us because we could help you to um, reduce the burden of those things so that you can hit kind of like the very basic minimum goals of eating and eating often enough. And then beyond that point, depending upon what your specific food and digestive issues are, we might have another, recommendation or two for sort of like how you hit the highest notes, hit the most important, most impactful notes of diet change without having it take over your life and take over your time and make things worse. Um, if you're struggling and your partner doesn't know how much you're struggling, we didn't talk about this with Lena the other day, but if there's a way to help to clue your partner in to what's going on so that they can do a couple of things, right? First, sharing the burden can help to relieve the burden. It can help you to process it through and to start to find your way through it emotionally. But also having your partner know that you're struggling and be available to be support to you can be incredibly helpful. And then also, uh, if they can take on some of the tasks that you might be finding to be overwhelming to you, that is another thing that could be really helpful. Now, sometimes your partner knows all about this and you still need a little bit of help. If you have a really close friend or a cousin, a member of your extended family who is nearby, who also could help pick up some of the slack, pick up some of the burden, you can certainly talk to other people as well, and you can ask for help, right? Asking for help is a huge part of receiving help and like getting on a path where you don't feel as overwhelmed. Um, in terms of, yeah, yoga is great, exercise is great. We do have some limitations in terms of what we recommend for exercise in general, because really high intensity exercise can interfere with your hormones. So I'm not in this moment saying like all exercise is good, more exercise is always better, but especially if you're a person who exercised as a child, a teenager, in college, in your 20s, that type of thing. Or if you just know your body and know yourself and you know that you feel better when you exercise, then when these things are going on, one of the things you can do for yourself, one of the ways you can make time and then devote it to yourself is to exercise. It is a great way to change how your hormones and your neurotransmitters and everything are firing. And it gets you to move your metabolism and breathe and do all kinds of things in a way that is clearing to your mind in large part. I'm not saying you will never be thinking about other stuff while you're exercising, but in large part, when you have an endorphin rush, it changes those things. Um, uh, we also talked, Lena, I think specifically is the one who brought it up the other day, faking it till you make it, which is not meant as a recommendation to like ignore things and pretend they're not happening, but more to say like, one of the tools that you have in trying to get your emotions under control, especially when there's something outside of your control, like a family issue, um, you can decide that you are going to address it with good humor, or that you are going to smile more, or that you are going to find things that are positive or humorous, or that you appreciate in things that you otherwise don't find positive. And so you can look for the positive. And this is not, oh, like I said, this is not a way of trying to pretend that things aren't happening that are happening. This is more about going through a process that is going to help to lay down new neural pathways in your brain. And that can be really shifting of your emotions. So, the like neuroscientists of the world, tell us that we have many millions of thoughts every day. And that the way that we're able to have so many millions of thoughts, because we definitely are not aware of most of them, is that most of them are the same thought over and over again. They just repeat over and over and over again, and that saves a lot of time. So we're able to cram in a whole bunch of thoughts, and it makes our brains really powerful, and it makes us, really capable of incredible things. So when you have the same thought over and over and over again, you lay down a very well-traveled neural pathway for that thought, which means that you don't actually have to laser focus in on every single aspect of the thought in order to think it. You kind of like start it off, and then there's a shortcut, and then you are done having the thought, and then it can repeat again. And the example I always use for kind of like a real life experience of this is, um, if you have a job where you go to an office or a site all the time, you regardless of how you commute there, whether you walk or take a train or take a car, you have a shortcut neural pathway for getting to work for your commute, like laid down in your brain. And so one day you might need to stop on the way to work to do an unusual errand, not just like run past the bank or, supermarket or whatever is like on your way, but actually go a little bit out of your way to like drop something off at the dry cleaner or something like that. And everyone has experienced ending up at work still holding the dry cleaning and realizing that even though you left your house with this annoying, dry cleaning that took up space and you had to carry and everything, that you um, never went there. You never completed your intention to go and drop off the dry cleaning. You just ended up at work and you don't even really know how it happened. And that is one of these well-traveled neural pathways that has a lot of shortcuts in it. And so your brain can just like recognize that you are starting on your path that is your commute and then just like take you to the end of it as fast as possible with as little brain energy, brain power as possible. And so when you are having a lot of like negative thoughts, worries, anxiety, fears, etc., they will tend to have things in common with other anxieties and fears that you've had before. And so they will tend to be part of this like well-traveled neural pathway that has shortcuts in it. And so there is a tremendous amount of value to disrupting those um, recurrent, persistent thoughts. And it's both because we want to lay down a well-traveled thought pathway that is positive, and also that we just want to disrupt the negative thought. So this idea of sort of faking it till you make it, insisting on having a positive, or if positive feels too scary or too inauthentic to you, a neutral thought, has a lot of value. So, one of the things you can do is you can, when you have a doom kind of thought, we can use Lena as an example, right? Like, did she have her HSG too soon after her surgery, or are her tubes blocked by new scar tissue formed from uh, removing the scar tissue that had previously blocked her tubes? The scariest, most awful thing is always going to be to think that she's defeated because she has formed a new scar tissue, and if removing the scar tissue is the treatment for scar tissue, but if she has formed new scar tissue after having scar tissue removed, then what can she even do? And that kind of like hopeless, pessimistic thought is so painful. And there actually are a lot of things that she can do. And we talked them all through on Wednesday, and there is a tremendous amount of hope. She may not know all of those things when she's going through this exercise at home, but what she can do is she can stop herself in the thought and she can shift it to a positive, or a neutral thought instead, and say, actually, it was probably too early. And I have responded to having my tubes cleared before. So there's no reason to think that I'm not going to respond this time. It doesn't mean that there's a guarantee that everything is totally fine, but she's leaving that room option, and that room open. And like you will start to feel a little more upbeat. You will start to feel a little bit better. You will start to have a bit more optimism if you start finding the optimistic or hopeful thought in the negative thought and then replacing the negative thought with that more hopeful thought. It's really it's proven neuroscience. And when I practice it myself, you have this intense feeling of discomfort or feeling sick or feeling hopeless or whatever it is. And then I usually have to like pause. I can't immediately turn that thought into a positive thought and have it have much benefit at all. But I can tell myself that I'm going to pause, that like I know how upsetting this thing is. I know how real and important this is. I'm not saying I'm ignoring it, but I am just going to hit pause for now and recognize that I don't know how to change things. I don't have a magic button that just makes everything different. And then once I've processed through a little bit in the background as I've done other things, kind of my emotional response to whatever the thing is, then I can come back to the thought with my emotions a little bit more in check. And then I can talk myself through all the things that I wasn't taking into consideration about how there is actually more hope and more positivity than I might have thought before. So I do think that this process of rewriting your neural pathways is and shaping the way that your nervous system responds to things is very valuable. So there is a person called Abraham Hicks. I'm pretty sure Hicks is the last name. Yeah. Abraham Hicks. Um, and they have a whole huge series of meditations and other. She's a motivational speaker, so she has lots of talks. And Amy absolutely loves her and has recommended her the entire time that I've known Amy. We've been talking about Abraham. Um, but one of the things that Abraham does that fits into this kind of like rewriting of your neural pathways, that not all people who do guided meditations or motivational speaking do, is that she doesn't try to force you from the negative to the positive. She allows room for there to be some negative in the positive. And when you are trying to make this transition, when you are trying to find a way to feel more hopeful, it can also often feel like too much or too fake or too unrealistic, inauthentic to shift completely to like a positive thinking model. And so she really like inhabits a space that is really helpful and really valuable in this kind of nervous system reorienting or training that you might do. From a supplement perspective, I would not call LDN a supplement. It is a medication. I do tend to um, be specific about differentiating between them for a couple of different reasons. One of which is that while doctors can make recommendations about supplements, you do not need a prescription for any supplement. And medications you almost always need a prescription for, and that includes LDN. For those of you who don't know about LDN, now I'm going to kind of combine the second part of Doreen's question with Lena's question, and then I'll try to circle back on supplements for mood and emotions. Um, LDN stands for low dose naltrexone. We brought this up as something, actually, I think it was the other girl in the group session on Thursday who first brought it up, but we had a big discussion about it. So LDN stands for low dose naltrexone. It's specifically called low dose naltrexone because it is a very low dose. This drug was originally invented in order to treat drug addicts, like heroin addicts, because it blocks a specific receptor, which is called the opioid growth factor receptor, um, which basically makes it so that people who are heroin, morphine type drug addicts, um, if they're taking high doses of naltrexone, not low dose naltrexone, but high doses of naltrexone, they are stopping their body from having the euphoric kind of like good feelings response to the drug that they're addicted to, which then allows them to um, withstand the urges and like put in the work of not actually taking the drug, um, and gives them a tool they can use for making that urge to take the drug much easier, but also like allows them some space to do kind of a similar type of mental work to what we were talking about before in order to change their reality and to change their needs and things like that. So it is specifically called LDN, low dose naltrexone, when it is used for a different purpose. It's done in high doses for that. And the primary way that it is used is for inflammation. So there is some good research on kind of like how it helps to reduce pain and inflammation. Um, there the pain can be all kinds of things, right? It can be like any type of musculoskeletal pain, so like back pain, neck pain, headaches, things like that. But they've also looked at fibromyalgia. They have looked at IBD. They've looked at all kinds of things. And what they find is that it is very effective in very small doses for all kinds of inflammatory stuff. And so we often recommend it for people who have kind of like systemic inflammation. Sometimes they have a diagnosis of a particular autoimmune disease, sometimes they don't. Um, and we use it a lot for girls who have something like endometriosis because they have all of this inflammatory tissue growth. So we were mentioning it to Lena because of the Ashermans, because of the tendency to grow tissue, and because she also has Hashimoto's, which is an autoimmune type of thyroid condition. So we know she has a documented autoimmune situation, and we know that she has this kind of inflammatory overgrowth of tissue that she's prone to in her uterus. I don't know exactly what Doreen is taking it for. She says she's on a 2.5 she says milliliter, but I think it's milligram dose. And she's wondering about increasing. So that is definitely something that you could do. It depends upon how long you've been on the 2.5, how effective you have found it. You do a practice that's called titrating up, and then you also can titrate down, but you titrate up your dose with LDN. So whether you're starting at a super small dose like 0.5 milligrams, or whether you're starting at a slightly higher dose like 1 to 1.5 milligrams, um, this is the range that the dosing usually starts in, and it's usually just the beginning of titrating up. And so often, maybe most often, I'll see it started at 1.5 and then increase to 3 and then increase to 4.5. But I also regularly see people who start on 0.5 and then increase to 1 and then to 1.5 and then to 2 and so on and so forth. 4.5 is generally like the most common stopping point for the most people. I have seen doctors talk about how they actually give higher doses than that to some of their patients. They are usually patients who are pretty big in terms of body weight. So that makes sense. I really never see it given above 4.5 in the fertility space, but depending upon what doctor you're under the care of and how experienced they are with it and what you're taking it for and what your symptoms are, like there is theoretically a place where like you would take more than 4.5, but most of the time you're going to be titrating up towards 4.5 and you might stop at 3.5 or you might stop at 3. So because you're so far down at 2.5 from the 4.5, I would say you definitely can continue titrating up. How long you take to go up each stage also varies a little based on who the practitioner is that's recommending it to you or prescribing it for you, but also based on how you respond to it. Most people don't have a lot of side effects. There are some side effects that some people have that happen when they increase their doses and then they disappear. And that's part of the reason why the dosing is this stepping up, this titrating up. So stuff like vivid dreams, which can result in an insomnia, a little bit of nausea or headaches, that type of thing. But most people feel fine on it. And people who have inflammation, who have like joint pain and other things, often feel good on it, which makes sense. That's the whole purpose. So, yes, Doreen, you could definitely titrate up. Um, Lena spoke to her doctor, and her doctor said that he doesn't prescribe LDN. And so she was wondering where else to get it. And so we do have a list of places where you can go. These are online pharmacies. It is a prescription medication, so you do need a doctor to prescribe it, but these online pharmacies have that service built in. So Ageless RX is a telemedicine evaluation like platform that also is a compound pharmacy. And Ageless RX is a place where you can get a prescription for LDN. You will have to meet with a doctor there. These other compounding pharmacies may do things a little bit differently. They may not have the doctor available. You may still need a doctor, and then they may only just ship you the medication. But Johnson Compounding and Wellness in Massachusetts, Skips Pharmacy in Florida, Belmar Pharmacy Solutions, and Bayview Pharmacy, all of whom are available online, all of whom we can give you websites for. Ageless RX is only one of many of these online pharmacies. It's the one that we have had the most experience with. So that's why it's the one that we talk about the most. But I'm just Googling to see if I Google them, like who else comes up um, as competition for them. Um, yeah, there are other telehealth pharmacies that um, will probably be able to prescribe it as well, but start with Ageless RX because we've had good experience with them. So what other supplements could someone take in order to help with the stress that they're experiencing? So this is going to depend partly on what supplements you're already taking. It's going to depend upon how you're experiencing the stress in your body and your mind. So if you are having digestive symptoms like constipation or diarrhea, we would take a supplement that might help with the constipation or the diarrhea. So like we were talking about with Sessa earlier, constipation, magnesium citrate is something that we can easily add or to a another form of magnesium that you're taking or change the form of magnesium that you're taking and see if that helps to get you pooping more regularly, which can help with like cramping and guarding and feeling really uncomfortable in your belly. Um, um, I wonder if I logged into the wrong one of these because none of you have shown up today. I wonder if I logged, I have two. I don't know why this happened. Sorry. I just saw a notification on Mighty Networks come up, and I'm wondering if well, if I'll come back to these supplements, but I'm having like a senior moment or like an early morning Saturday, beginning of January moment. So I apologize for this. I might have clicked on the wrong Zoom link, and used my Zoom link for the Q&A session that I do for the girls that are not in the FFP program. And if I did that, I'm really sorry. We changed all the links for the new year, and I may have just literally clicked the wrong one. I will talk to Jackie and make sure that this gets posted in the right place if it turns out that I was in the wrong link, which maybe I'm just second guessing myself and it's not happened. But I really feel like you guys usually show up for this always, and there hasn't been anyone here, and we're almost at the end of the time. So sorry about that. Um, I will double check it and make sure. Anyway, so if you have constipation, we would address supplements that would address constipation. If you are having diarrhea or nausea, we would be less maybe looking at supplements to address the diarrhea or the nausea, but thinking more about what you're eating and how you're eating, and how we can keep that nausea from happening. If you are feeling like you can't breathe, we did talk about deep breathing and other breathing techniques, and those are really helpful. The meditation is really helpful, but you could also do the exercise could be helpful too, but you could also do other things, like massage or baths or a sauna or hot tub, as long as you are only doing those things pre-ovulation in any cycle in which you could conceive. Some of that like heat to relax the muscles of your body will help with releasing the tension in your chest and allowing you to breathe better. Um, if you are experiencing racing thoughts at night and you're having difficulty sleeping, insomnia, then we would want to try to address sleep. And that is something that we could try to address with supplements. Another form of magnesium, I always have a mental block about whether it's magnesium L-threonate or L-threonate. I think it's L-threonate, but I always second guess myself. Is a form of magnesium that does cross the blood-brain barrier, and so it can be more relaxing and more helpful with sleep. So we might try switching you to that. Um, some people will take a little bit of melatonin. We don't really recommend high amounts of melatonin, but a milligram, 1.5 milligrams, something like that could help with falling asleep. I also talk to people a lot about sleep training, and like doing things to make sure that you um, make sure that you Oh, I have another question that popped up. Maybe that was the notification I got, and maybe I didn't screw this up. I don't know. Um, you wouldn't think being on vacation for like less than 2 weeks could make you feel like you're starting over again, but somehow um, all that relaxation like makes me second guess what I'm doing now, just on like the administrative details. I'm usually super hyper organized. Um, oh yeah, sleep training. That's another place where we want to be laying down neural pathways that support and promote your body sending you into sleep. And so there's not a lot of time to talk through all of that here, but like having good sleep hygiene, if you're experiencing sleep disruption, is really not just like important, but really beneficial. So I always say really obvious stuff. Your bedroom and your bed are a place for sleep and for sex, and then occasionally for like recovering from an illness. But ideally, they're not really a space that gets used for other things. They should be a space that is somewhat protected and like neutral in terms of interference from the stressful things in your life. Now, obviously, not everybody, especially when you live in a place like New York City, where apartments are small and still crazy expensive. Not everybody has the luxury to not have their office or their desk or something in their bedroom, or not have to store things that could be stressful and make things a little more cluttered, in their bedroom. So we're not asking for perfection, but I do recommend looking around and just taking stock and making sure that things look good in the bedroom from a stress relieving perspective. That when you're going to bed and in bed and trying to sleep, that you're not going to be distracted by a lot of things like a stack of your unfiled taxes, or you know, um, a project or something that you like need to do, or even like your desk. If you have to, when you work from home, if your desk is in your bedroom, is there a way that you could put away the work documents and like other things, the clutter of the work on your desk, so that it's a kind of like a clean surface when you're going to bed? And then always bring it back out again when you work and then put it away again. Um, then we want to have good sleep hygiene in terms of the darkness, in terms of the temperature, in terms of the smells, in terms of how cozy and comfy the bedding is, all kinds of things. These are not things that have to cost a lot of money or take a lot of time, but you do want to think about them and make sure that you're doing what you can to have an environment that is conducive to sleep for you. Then we want to repeat the same habits, the same habitual, sort of ritualized activities as you are getting ready to fall asleep every single time you get ready to fall asleep. So that means at 10 p.m. when you go to bed for the first time, whatever it is that you do then that is like your cozy ritual that helps send you to sleep. If you wake up at 3 in the morning, we're going to try to repeat that as close to the same as possible. So whatever position you snuggle into and however you fluff your blankets and like pat your pillow, we want to do that again. If you are listening to something like a audiobook or a guided meditation or music or something, we want to try to do that again. If you're sharing your space with a partner, you may have to do some type of headphones that work for sleeping so that you can listen to things and not disrupt him or her. But otherwise, like, you want to try to replicate the same thing. And the goal, just like we talked about before with like laying down new neural pathways, is that if this is the neural pathway, if this is the set of ritualized behaviors that your nervous system and your brain comes to expect results in, the next thing being that you fall asleep, then it becomes a shortcut. It's a way of shortcutting yourself into falling asleep. Is it going to work 100% of the time? No, it's not. But is it going to work more than you thought that it would if you actually put in the work to create this set of ritualized habits? It really does. It's pretty cool. Um, so some people, it only takes a week or two of doing it, and they are already noticing that it helps them fall asleep quickly. If you're a person who reads in bed, I personally have done this kind of sleep training for myself, and like it's just shocking how I'll just keep falling asleep on the same sentence. If I wake up twice in the night, I won't read past the same sentence twice. Like the next time I wake up or the next time I go to bed the next day, I realize I'm still on the same sentence. It's absolutely incredible. So that is something that we want to do. So those are like things that could help with different aspects of stress. Um, there are supplements that address your adrenal function, that address cortisol, that address stress in other ways. And sometimes those can be beneficial, but I do think that I would need to like know more about you, Doreen, or if you don't coach with me, so you could talk to Heather or Amy about it. They will know more specifics about how you're trying to conceive, and what other supplements and medications and things you take, because some of those other supplements can be taken for a period of time, or they can only be taken pre-ovulation or, other things. But I wouldn't want to just like blanketly recommend them here. So I think that's everything. And now I'm totally paranoid that I have been recording this in the wrong Zoom link, which won't be a problem for the recording, but I will have to post an apology for anybody that tried to log in and didn't find me there because, yeah, maybe I didn't make the mistake, but maybe I did. Anyway, um, it will at least teach me not to make that mistake again the next time. And these were really great questions, so I'm glad you guys posted them, and I'm looking forward to seeing all of our new cohort soon, and to continuing to work with the rest of you. And I hope that you and I and everyone has a really prosperous, fruitful, hopeful, and happy new year. And I will see you again soon. Bye.